Welcome to another Doctor Health Mastery series. Today I want to talk to you about a condition called Morton's neuroma. I saw a female patient in her 50s who had been experiencing pain in her left foot for about 8 to 12 months. She described the pain as a burning pain and worse when she stood up or walked around. She denied any particular injuries, doesn't remember any prior trauma in childhood. Upon examining her, the location of the pain was around where the metatarsal bones, these are the mid bones of the foot, join the toe bones. We call this the metatarsal phalangeal joints, specifically over where the second and third metatarsal join the second and third toes of the left foot. This raised a suspicion of something called a Morton's neuroma, and an ultrasound scan was requested. The ultrasound scan confirmed the Morton's neuroma. There was a partially compressible hypoechoic image measuring approximately 7 by 6 millimeter in the second web space, likely representing a Morton's neuroma burst cell complex. So what is a Morton's neuroma? Morton's neuroma is a condition that affects one of the nerves that run between the long bones, the metatarsal bones in the foot. The exact cause isn't known. This condition was named after a Dr. Morton, who first described the condition in 1876. The symptoms include what this lady presented with: pain, burning, numbness, tingling between the toes of the foot, often made worse by wearing high heels, or you may notice that it is particularly worse with certain types of shoes, and when you don't wear those shoes or change the shoes, the symptom gets better. Any new symptom that persists for several weeks to a few months should cause you to see a doctor. I wouldn't advise you to assume it is a Morton neuroma and not see a doctor. It is a condition that affects the common plantar digital nerves that runs between the metatarsal bones, the long bones of the foot. It most commonly affects the nerve between the third and the fourth metatarsal bones, but it also often affects the nerve between the second and the third metatarsal bones. It very rarely affects the nerve between the first and the second metatarsal bones, your first web space between your big toe and your second toe, or between the fourth and the fifth metatarsal bones, the fourth web space between your fourth toe and your tiny little toe. Whilst we're not sure what causes the condition to develop, it is a non-cancerous tumor. So anything that's a growth in the body is called a tumor, but this is a non-cancerous tumor. It is benign, that grows from the fibrous coverings of the nerve rather than within the nerve itself. So what you see is a thickening of the nerve, but because it's within a very narrow area, it causes pain. Long-standing irritation or compression of the nerve at thought contributes to this thickening of the nerve, which causes the nerve to be squashed and rubbed together, over time causing it to progressively increase in size. Sometimes other conditions can actually cause the same symptom to develop. For example, you can get something called a lipoma, which is a growth of fat cells that then presses on the nerve itself, or you can get extra bone growth to the side of the metatarsals, which press on the common digital nerve. The vast majority of people who develop a Morton neuroma are women. So 3 out of 4, or 75% of people who develop Morton neuroma are women, and patients are usually between the ages of 40 and 60 years old, but it can occur at any age. As I mentioned, in the case of the patient I discussed earlier, the diagnosis is often made by an ultrasound scan, which is done after a history and an examination finding that raises the suspicion of a Morton's neuroma. Occasionally, an MRI scan may also be done. Sometimes X-rays are done, but an X-ray doesn't make the diagnosis, as X-rays are usually only very good at looking at bones. The point of doing an X-ray would be to rule out other conditions that may be of bony pathology. The treatment of Morton's neuroma is mainly non-surgical, non-medical. About a third of cases resolve without any medical intervention. The power lies in your hands. There are lots of things that you can do to relieve your symptom. For example, choosing the right footwear, less high heels if you're a woman who likes to wear high heels is very important. You want to wear shoes that are not too constricting, not squeezing your toes together. Shoes with pointed fronts tend to exacerbate the problem as it squeezes your toes together. Wearing comfortable, wide-fitting shoes can be beneficial. Sometimes it is helpful to wear pads under the metatarsal phalangeal joint where you're experiencing the pain. So if these are your toes and these are your metatarsals, putting the pads where the metatarsal join the toe bones can be helpful. Occasionally, if the pain is not relieved, then a steroid or local anesthetic injection can be helpful. Additional treatments such as the use of radiofrequency ablation, freezing therapy, or sclerosant injections are not commonly available treatment options in the United Kingdom. If the following measures haven't helped at all and you're still in a lot of pain, then you may require surgery. A surgeon, which I'm not, would make a tiny cut in your foot to isolate the nerve and increase the space for the nerve to be compressed less, or shave the fibrous tissue overlying the nerve, or in some circumstances, remove the nerve itself. As you can probably predict, if the nerve is removed, this will usually lead to permanent numbness in that area, but it will relieve the pain that you're experiencing. About 3 out of 4 people who have surgery actually get a satisfactory outcome, meaning their symptoms are significantly improved and are better off after the surgery than they were before the surgery. In summary, a Morton's neuroma is a benign growth affecting the fibrous tissue of the digital nerves along the long bones of the foot, the metatarsal bones. This growth compresses the nerve in a very narrow space, causing pain, burning sensation, tingling, sometimes numbness. The good news is 1 out of 3 patients will get better just by changing their footwear and wearing something a lot more comfortable, such as less high heels, less pointed shoes, more wide fitting shoes. If that's not been helpful, then you can have injection of steroid or local anesthetic to the area. If still that isn't helpful, you may benefit from surgery. The good news is 3 out of 4 people who go on to have surgery have a good outcome, but 1 out of 4 do not get a good outcome. So that is something that's important to bear in mind and to discuss with your doctor. Well, that's a quick whistle-stop tour of a Morton's neuroma. So if you have persistent foot pain, especially along the long bones of the foot or around where those long bones join your toe bones, we call the metatarsal phalangeal joints. If you have a persistent pain without any injury or burning or tingling sensation or numbness, go and see your doctor, and you may benefit from an ultrasound scan to see whether or not what you have is indeed a Morton's neuroma. I wish you all the best on your journey towards becoming a master of your health.